So what do we do when a patient comes to my office and says, I had a hair transplantation and I'm not happy? It can be because it was not completed correctly. Maybe the hairline is not correct. Oftentimes there can be hairs at weird angles. Oftentimes they see kind of lower grade hair transplantation where hairs are angled, especially on the side, almost like a sundial that never looks natural, or the density isn't right. Everybody has a different expectation. Sometimes the expectation, and I feel like this is kind of an appropriate way to look at hair transplantation, is, you know what, I look better. I'm happy and life is great. But you know what, I'd like to get a little bit more. On the other hand, there are some patients that have hair transplantation. In our eyes, they look great, but in their eyes, they do not. And this is where a conversation needs to happen, and we need to figure out how things can be helped. Oftentimes, especially if we're doing hair transplantation from the front to the back, it takes a lot of grafts. And depending on the head geometry, those graft numbers can really expand. The other aspect that comes into it is some people have very thin textured hair, and when we moved the follicle groupings, they had less hairs per grouping. And this all comes into hair count and volume count, which then ultimately affects your ability to have a great result. We have compassion towards this. We can really help. I've been through the process twice. The first time I was very unhappy with. Second time is kind of what you see on my head right now. So I know exactly what you're going through. If you are somebody who has had hair transplantation and is unhappy, we are here to help you. And if you're tired of wearing a hat after a bad hair transplantation, we should talk.